Hello, everybody. It's Dr. Troy here with Everything Disc. I'm excited about today's episode. I got my good friend. He's actually a golfing buddy of mine. He helped me do some fitness stuff for myself. Adrian, welcome to the show today. I know you got a background in athletic training. You're licensed with the state of Washington, and you actually used to work at a gym that the Portland Trailblazers used to train at. It's a little fun fact for people. So I'm excited you're on the show today. I told you we are just going to have fun. We're going to talk about how to get people healthier, how to get them fitter, what we do that really can help change people's lives and get them feeling better. So maybe just take a minute, introduce yourself to our guests, tell us, kind of what you do throughout the day, and then we'll get into the show.
Cool. Hey, thanks for having me, Troy. I'm really excited to do this. I know we've been talking about doing this for a couple of years now, so I'm glad to see you actually doing it. And that's always cool to watch your peers and your mentors like actually do what they're going to say and actually make some differences in people's lives. And I commend you for doing that. So really nice job.
Thank
And also it's so nice to have you in Salmon Creek.
you. Yeah, you're right
That's
down the
pretty
road
cool.
from me.
Yeah,
Yeah.
I know. And I still have yet to come over and see you, but I promise I will. I've just been really busy.
Yeah.
But just a little bit about myself. My name is Adrian Cagigas. I own a small sports medicine clinic in Salmon Creek, Washington. It's called Uptown Sports Medicine. I've been a licensed athletic trainer, like Troy said. Now it's going to be 30 years this year. I can't believe it. It's how time flies. But early in my career, I used to work with a lot of athletes, and I was always on the sidelines at a lot of games. I was an athlete myself growing up. I played football, soccer, and baseball in high school. And then I was lucky enough to play college soccer at Humboldt State University. And that's how I fell into athletic training. And a lot of people don't know what athletic training is, but I got injured playing with the team. I always loved anatomy and physiology. And I was kind of going, should I go physical therapy? Should I go pre-med? I just didn't really know what I wanted to do. As most young people, they don't know what they want to do yet. And that's totally normal. And I got injured and I found the athletic training room and I just kind of took that course and graduated from there, went on to get my master's at San Jose State. And about 12 years ago, I worked in D1 college. I've worked in every single collegiate setting there is. I never worked in pros. I worked with some pro athletes, but I never actually was on any professional athletic teams as the athletic trainer. But D1 through D3, JC, high school, lots of clinical settings and physical therapy clinics, and found personal training and just found that my skill sets as an athletic trainer with a lot of people out there who have some sort of musculoskeletal pathology that, like you work with, Troy, on a daily basis, really need some extra help in the gym sometimes with what they may need to meet their goals.
Yeah.
So about 12 years ago, I started my own business here in Salmon Creek, and it's been great. I was very, very nervous to do that in the beginning, and that's the best decision I've ever made. So it's awesome.
Yeah, it's good to be on your own, instead of working under somebody's thumb. So you can use your creative skills. So that's awesome. Yeah. I didn't know some of the stuff that the background you have, but that's pretty amazing. So one of the things we've talked about, and I want to get you on the show is kind of get your take. I created this show, Everything Disc, because so many people have disc problems. If you look at the charts on degenerative disc, bulge disc, herniated disc, spinal related problems, as we get older, like by the time you're 80, there's a 90% chance that you have degenerative discs and bulge discs in your spine. And these can be debilitating. So what typical joint complaints do people come to you with? Do you see?
So in my practice, I kind of call it a practice because we specialize primarily in personal training, but most of our clients have some sort of, like I said, some sort of doctor referral or PT referral or something that they're working with their healthcare provider, whether it's blood sugar, weight loss, etc. But we do have a lot of people with back problems, obviously. And I think for me personally, it's such a shotgun on what we get. I mean, we'll get ankle stuff, we'll get knee stuff, we'll get shoulder stuff, but well, I've come over my career, what I've really found out just in analyzing people's postures, biomechanics, and what they have going on is usually when I get somebody in my facility, they're going to have some form of exercise imbalance. So some sort of musculoskeletal imbalance. And so my job is to decipher what that imbalance is, whatever joint it may be, whether it's a lumbar spine, thoracic spine, cervical spine, hip. But what I really find is that a lot of people have a lot of imbalances through their hip region and their core stability region. So those all kind of tie together with all the joints. So like you said, most people, like I have some clients that are in their 80s. And of course, they're going to have osteoarthritis at multiple joint levels. It's just a natural part of our aging process. So if we can make people more mobile, more strong, and more balanced especially neurologically. I mean, that's really what we're trying to do, is correct those neurological imbalances that people have. So that's, I think, what separates our facility apart from like a 24-hour fitness, for example. You know, you go in, they just want to work you out like a general fitness, which there's nothing wrong with that. But
Yeah.
if you're in pain, like, you know, when pain
Yeah.
is a very strong motivator, people come to you because they are in pain. And I'm sure you can attest to this. Like, half of our job as healthcare providers is just assuring that individual that they will get better, but just talking them through that inflammatory phase to injuries is,
Yeah.
it's challenging, right? And especially
Yeah.
with, I'm sure with what you have, and you have people in chronic pain, so that's even more
Yeah.
debilitating. Pain is the most, for me, is like very, very motivating for people to get back into shape, whatever that may be, whether it's just walking out and getting their mail or running a marathon.
Yeah. Well, you know, when they're in pain, they don't want to work out, they don't want to move, they don't want to, do anything. They just want to sit on the couch and, and eat bad food. And so that leads me to my next topic. And we were talking about this because, the other day, and we'll get into some golf maybe later at the end because a lot of our listeners like golf. So we
Yeah,
want to
baby.
save that. We could talk about that all day. But
Let's go to our
what
happy place right now.
I just want to tease our listeners.
Okay.
But so if we're going to look at pain, pain is a chemical reaction, and the biggest thing where our chemicals go through is through our mouth and obviously skin and all that. But and I see, you go to the so-called health food store and it's full of junk. And people go, "Oh, I'm eating organic," but it's organic white processed sugar junk, and it's processed the same way as all these other addictive chemicals. So what are some of the things that you recommend or you see in people's diets that are holding them back from really achieving a higher level of health?
I think number one, with people that drink alcohol on a daily basis, it's physiologically impossible to metabolize. And I don't want to go too deep into this. Isn't like a college class discussion. This is more for layman, I'm assuming, right? So
You don't want to
if
get in the Krebs cycle or anything like
no,
that?
no, but you have to understand that how we metabolize stored energy, which is essentially our body fat, et cetera, is primarily through our liver or when we go to the restroom, and when we breathe. So that's really how we metabolize our fat to make it as layman as possible. So if you are constantly throwing all these toxins into your body, whether they're processed sugars, flours, all these processed food items, your liver is on overdrive trying to process all that stuff first, and so it's really hard to maintain that nice homeostatic balance that your body likes to live within. Yeah, processed foods, not great, and they're hidden. And the fascinating thing for me with diets is the carb thing. When I ask somebody like, okay, this is my test with like a new client, for example, is like, tell me the definition of a carbohydrate. And what they all will say is bread, pasta. They give me food items. They don't
Yeah.
give me the biochemistry of what the carbohydrate actually is. And it's just five simple sugars. So it's I think for people, if they can just like start cooking more at home and
Yeah.
understanding like what the cake is actually made of, like what that box they buy is the cake, for example, like what actually is inside that cake. And it's so much easier for people to understand if they actually physically measure out how many grams of sugar, how many grams of salt, etc. And it's amazing all the stuff that's in our food that we don't even know what's in there unless you read
Yeah.
that long, long list.
Yeah. And usually it's full of sugar.
Tons,
So yeah, that's
tons of hidden.
it's interesting you speak of alcohol too, because that's sugar as well. You're just feeding that cycle. So that's what I tell my patients. I had a conversation with a patient the other day. I'm like, you got to get off the sugar. They're like, I don't eat sugar. I'm like, do you eat bread? Yeah, well, that's not sugar. And I'm like, yeah, it was a whole grain. No, but I'm like, you're basically eating junk sugar, and there's no way you're gonna reduce the inflammatory effect in your body. You're actually exacerbating it. So diet. I always see that diet's 80% of the story. Maybe even 90%. So let's say we get diet addressed. Now, are you big into stretching exercises without stretching? What kind of daily routines do you usually recommend people do that have pain issues in like a shoulder or their neck or their low back or knee or hip? What kind of things do you recommend?
Yeah, mobility training is really coming to the forefront of a lot of performance driven athletic training or personal training. I mean, it's a lot of it is mobility, right? Like there's a reason why these NFL and professional athletes, all athletes are bigger, faster, and stronger now. And it's because the literature is really diving more into injury prevention, which is going to be mobility. And we'll talk, I'm sure, about that with golf, especially.
Yeah.
But
And when
yes,
you say mobility, do you add strength to that? Like somebody just stretches, but they're not strengthening, they can actually make that joint hypermobile. And
sure.
now they're even more susceptible. Are you talking about that?
Absolutely. So that's again like when we take, because in my clinic, one piece doesn't fit all, right? So
Yeah.
we take and then we personalize every single client that I prescribe an exercise to. But with that being said, there are certain exercises and stretches that work better than others, and they've been clinically proven to be the most effective. I do tend to, like in my toolbox, tend to lend to certain things based on whatever that person's trying to achieve. So if they have very, very forward posture, we're going to really try to open them up, for example. Or if they're hamstrings, hamstring tightness, piriformis tightness, all that stuff, we want to get that loose because that theory reciprocal inhibition, if everything is front, for example, in the tight, the stuff in the back, the muscle will not fire. So
Yeah.
it has a linear agreement with one another. So mobility training is extremely important for getting that muscle to actually fire.
Yeah. And that's what I see a lot with people who have chronic back pain, and you'll see disc herniations. It all starts with the joints not moving right and the inherent weakness. And I always say it all starts from trauma and the joint not moving right. Over time, the joint's going to break down. And if it's in the spine, that eventually is going to lead to a disc bulge or herniation or even a rupture, which, now we can't even help them. Strengthening's good. Mobility's good. If you had to give somebody like the top 3 exercises to really improve their overall health, what would you say?
So in
I know
terms of overall health, I would
yeah.
say walking is number one.
Okay. Love it.
Just in terms of overall health, walking, I think people become more, especially in our society today. I mean, you see all these young people, 30, 40, go to an airport and ask and tell me how many people are not on a device.
Yeah.
There will be
Yeah.
like 0 people, literally. Everybody's got their head forward. They're putting a tremendous amount of force on their cervical spine. The posture's bad. But walking, just the sedentary lifestyle that we live, we get up, we go sit in our car for a couple hours driving to and from work. We go sit on our butt all day at work. And all of our systems are just struggling because our human beings are meant to move.
Yeah.
So
Yeah.
I'd say
No, that's it. Number 1
walking
walking.
number one. I'd say just a daily stretching routine number two, and then some form of resistance training. The American College of Sports Medicine recommends, 150 minutes of cardiovascular fitness per week and 2 to 3 times of resistance strength training per week. And that's just to maintain a nice longevity, if you will.
Yeah. Well, even the people that have this sedentary lifestyle, they're more susceptible to diabetes, sugar intolerance,
All
bone
that stuff.
loss, all kinds of health issues. And that's the hardest thing in my clinic is to get them off the sugar, get them moving. I'm like, just 15 minutes a day, that's just go move. And I know you're into walking because you broke 2 of your treadmills recently in your gym. Well, you didn't break them; the clients did.
Absolutely, because I'm 53 now, and I mean, I used to be an athlete when I was younger. I did some extreme training regiments, for very long periods of time. I was extremely active. When I grew up, we didn't have internet, so we went outside and played all the time.
Yeah,
Um,
yeah,
but as a 53-year-old, and that's the reason why I kinda got into playing golf, I kinda got a little had some personal things happen in my life where I became where COVID happened and some other stuff that I don't really wanna talk about, but I put on some weight, and I was like, I need to start moving because this isn't good. This isn't going to be good. So I got into playing golf, and actually, one of the reasons why I started playing golf is to actually get back in shape and walk. And so I play with another friend of ours, Rob, and he will only walk 18.
yeah,
So I just
yeah.
started walking, and
Well,
it's
when
great.
when you met me, I had you know this, I had AFib, and I didn't know I had AFib, and I was trying to do all this stuff, and I was just losing my energy, and then I had a pretty severe episode, and then, I was working out with you, and then you're like, "Go do cardiac rehab," and that was their big thing, is they put you on the treadmill, and they start building up your resistance, and I came out of AFib, I had 20% heart function. Now I'm at 63%. I mean, I'm back to normal, and I always wanted to walk, but I took the cart, and then I started walking, and now I'm like, I don't even want to take a cart anymore. I want to walk. And so, I attribute that to you. My first golf coach, Garth, he introduced me to you. And so you and I kind of are on the same path golf wise. Um, I read a book recently and it talked about this guy was talking about he coached 7-time winner of an Ironman, 7 in a row wins for an Ironman. And the big thing takeaway for me, he said, walk at least 15 minutes a day, if not 45 minutes a day. And I went, wow. And you can do that in your 90s. And I always tell my patients, walk. You can do that when you're 90. You're not going to see a 90-year-old at CrossFit doing 400-pound squats and 250-pound bench presses. So it's just not
Well,
happening.
look at Ron Blem, like one of my clients. He's 86. Play golf with him every Friday. I mean, not right now because he's in Palm Springs. Hey, Ron, if you're listening, but but that guy is right down the middle of the fairway, and he's 86 years old, and he's
Yeah.
phenomenal.
And that's I love it. That's a testament to where we want to live, you know?
And this is back to your point you made earlier that I wanted to just touch on really briefly. One, you can't outrun a bad diet. Meaning, if you have a bad diet, it doesn't matter how much you work out because you're
Yeah.
just putting in all this extra stuff. Like you tell your
Well,
patients all
it's
the
extra
time.
stressful. So
It's
now
extra, yeah.
and working out is stressful to your body and you're not giving it a chance to recover. So it's just going to break down.
Correct. And then number two, for the people that are at home saying to themselves, I'm in pain and I don't want to move because it's going to hurt. Unless you have a severe structural discrepancy of something that's like, like something very serious that requires surgery, because that does happen sometimes. The worst thing you can do is to do nothing. Like
Yeah.
when I deal with a lot of my elderly clients, they're just concerned about not falling down.
Right.
Absolute worst thing they can do is not move. You can get with somebody, a healthcare professional, physical therapist, you, me, whoever, and you can still find those people are skilled at prescribing you movement patterns that will not hurt you and will help you.
Yeah.
Because the absolute worst thing that you can do is just to stay sedentary for long periods of time. And I see so many elderly people because I've done for 10 years. I was a consultant for a assisted living community in town, and I got to go to a lot of assisted living communities, and a lot of those people, they were scared to fall, and so therefore they chose to sit.
Yeah. Well, then they need the walker and the canes. And
Yeah,
man, I love it. I had one last week. She was in a walker when she came to see us, and now she's walking normal again. And the
there
stuff
you
that
go.
we do is pretty amazing. So, all right, so we're gonna dive in here to the fun topic, which is golf, right? And I got to tell you that for me, playing golf, I went, you know what? One of my good friends, he's a member at a really fancy country club, and he's almost 80. And he told me, he's like, if I don't stretch every day, I can't play golf. That's his life. He's retired, he spends his time on the golf course. And I went, wow. And you look at some of these older players like Gary Player, who's 90, and he says golf starts at 50. So if you really want to play better, whether it's golf or in life, you got to have some sort of routine. And so what are some of the common issues you see with golfers?
Okay, so with the golf journey, I've always been an athlete, like I mentioned earlier, and I would play golf extremely occasionally because before I opened my own business, I worked, like Troy mentioned, I worked at this place called Club Green Meadows in Vancouver, Washington, where the Trailblazers, that was actually their home
Yeah. Yeah.
practice court in the 80s. And I
Yeah.
didn't know that moving here. And I met a lot of people there, and it has an 18-hole golf course. Well, I would mess around as a kid, because I grew up very middle class. I was the oldest of 5 kids. We couldn't afford like 5 sets of golf clubs and going and playing golf every weekend. We just couldn't afford it. So we'd mess around in the backyard. I had a 9-iron. So I had a little bit of the understanding of how to golf, but I had never had like a formal lesson before. And so this other client of mine, I helped him. He was at the time in his mid 70s, and he never wanted to play golf because his back was always hurt. And he went and started taking lessons with Garth. And so with my health journey, I wanted to start getting back in shape. So I went and had a lesson with Garth. And now that I understand the biomechanics of what it takes to produce a golf swing much better than I used to like 4 years ago, because I've only been
Yeah.
really playing golf for 4 years. You really have to be able to disassociate the top part of your body from the lower part of your body. I mean,
Yeah.
that's essentially, there's just like building a cake. There's some basic movement patterns that have to happen in order for you to hit a golf ball appropriately and
Yes.
consistently well. And I'm
Yeah.
impressed with how you've gotten so much better, Troy. It's amazing. Like
Well,
playing
I
in the
think
simulator.
yeah, no, I think part of that is the fitness program that I'm
Absolutely.
working on, and just working on okay, what's really these weak areas, whether it's shoulder, low back, your hips, and if you talk to John, who was on the Corn Ferry tour, he says hips and thoracic spine are two of the big things that really hold us
Totally.
back.
Totally. I would agree with that 1,000%. And the best thing to do, I remember one time I was waiting to have a lesson at Westside over here in Salmon Creek, and I was sitting in my car, and it was a summer day, and I was just sitting there and I was watching everybody swing the golf club. Nobody could get into a position to hit the ball well, man. And
Yeah.
it's not that they didn't know what to do or want to, I'm assuming, but their body just physiologically could not make that the motion of what your top part of your body, bottom part of your torso need to do. You have to be able to
Yeah.
disassociate the two. And then
Yeah.
to get that club head into the slot. So with my golfing clients, which I have quite a few now, we really work on hip mobility, hip tightness. Like John said, you can't. I remember my first lesson with John, I couldn't get into some of the positions that he wanted me to get
Yeah.
into. Even with putting, he changed my putting posture and my external rotation of my forearm. I just could not do it because I was so
Mhm.
tight. So I
Yeah.
went to the back to the gym and like, oh, I didn't know that that's the posture that you're supposed to be in. And so I started working on some stretches and it's really helped.
Yeah. And I think I read a while back, and I was telling you this, that the average runner, when they run, they're putting 4 times their body weight in compressive forces on their spine. With golf, it's 8 to 10 times. So if the joints in the spine are moving, you got weak muscle patterns. Like I was telling you earlier, if somebody has a herniated disc, you'll see on the MRI, they usually have disc atrophy in the supporting muscles. You'll see it. Look, it's fatty infiltrated, like a ribeye on a steak versus like a nice filet mignon with no fat. So once we start developing these abnormal movement patterns, and then you go and swing a club or walk or even work out or walk your dog, go out and mow the yard or dig. Now you start creating these inflammatory states. And if you don't address that neurological weakness and movement pattern issue, then you're headed for, a train wreck.
Yeah.
So,
And you're not going to be able to get into the position. One, you're going to be in pain and unhappy, right? And two, with regards to golf or any other movement, your body's not going to be able to get into the right position. And then you're going to try to assist that with other major muscle groups or smaller muscle groups. And then everything's just going to unravel. And then that whole pain spasm cycle is going to start like all over again. So
yeah. So going back to our golfer community, we're gonna lean on them a little bit. If there was one thing you could tell, I did a podcast with John from Westside, and I said if there was one thing you would tell golfers to improve their game, what would it be? What's your one thing?
improve their game,
Their golf game. If
like
there
in
was
their
one thing,
sport,
one tip, anything. How if you could give them one thing to improve their golf game, what would it be?
putt and chip.
Putt and chip. Which one more important? Putt. Okay, make more putts.
It's the only way that I broke. That's the only way that when I first started golfing, my first goal was to break 100. My average score was 120. Earth said, how many putts do you have around? I'm like 50, 60 putts per round. I'm like, you track that? He's like, yeah, track that. And so how did I break 100? Putting. How did I break
Putting.
90? Putting. How did I eventually break 80 this year for the first time, which I'm so proud of
Yeah,
myself? And a
that's
hole in
awesome.
one, but we're not going to talk about that.
Hey, right on. Good job.
It
We're
was
talking about it.
putting. It was all
Putting. Yeah,
putting.
yeah. I
50% of
love
your
it.
score, putting.
I love it. So I appreciate your time, but what would you tell our listeners? For focusing on this new year, what would you tell them the top 3 things to do to improve their health would be?
One, make small, attainable goals that you can stop complaining and start changing. That'd
Yep.
be number two. So I have that often. A lot of people play the victim. I'd rather complain about it. I can't do it. I don't want to do it. Just make 3 small goals for yourself and attain them.
And what would a goal be? What would you say what a goal might be?
Like, for example, let's cook at home 3 or 4 nights a week instead of
There we
eating
go.
out. You're gonna
Okay.
save
Love it.
money. You're gonna
Yeah.
save yourself caloric deficit. Take a cooking class. I don't know. Like,
Ooh, I
do it
love
at
it.
home. Spend time
Yeah.
with your family. Sit down at the table and actually talk to one another and get off the devices.
You know, no, I was going to tell you, we'll come back to that. But the other day, like before, we used to serve dinner. My wife would kind of do buffet style at the counter, and so kids would come along, and the hungrier ones would go first and eat and then leave. And so recently, what I started doing, I make a salad. Okay, everybody, dinner time. So they all sit down. We all have our salad, and the meal's ready to go. Okay, salads are done, and then I bring them. I bring them the rest of the food, and we've been at the table for like 40 minutes instead of like 3 minutes. And it's been
Awesome.
really, really, really cool. So I would agree with you on that. What's number two?
Number two, just get active, and it doesn't matter what you choose. If you want to go, I mean, do it with a realistic goal though. Like, don't just go join like a CrossFit if you're like 90 years old. Don't do that.
Yeah.
But
Yeah.
CrossFit's great for somebody that can handle the load. It's anything that can hold you accountable. Join something that can help you get accountable. If you cannot maintain your own accountability through a movement, whether that's 2 to 3 times per week, hire somebody. It's it's so worth the money. in my opinion, to maintain a good wellness and longevity for yourself. And then three, you just got to make good health decisions with regards to the kitchen. Like Troy said, I would agree. I usually say 87% um, of losing weight, losing fat is going to be what you put into your mouth.
Yeah, yeah. Yeah, well, they say that health begins in the kitchen. So, I mean, and nowadays, there's more garbage out there than ever. So,
I
amazing.
have a client of mine, he's a physician at Legacy, and he's a vegetarian. And he's like, hey, Adrian, there's fat vegetarians, you know,
Yeah, oh, yeah, well,
or obese. I
they're
shouldn't
eating
say that.
they're
I
eating a
shouldn't
lot of
use that word.
carbs.
Obese. No, I shouldn't say that
Obese,
word, but
yeah, yeah.
obese.
But yeah,
Yeah.
yeah, we get it. Yeah, and they're usually carbs, and they're swollen, and
Sugar.
they're sugar, and they're one of the most unhealthiest groups, especially ones that like, oh, I'm eating organic white flour, but I'm vegan, and I'm like, but that's just now you're looking at sugar, so it's crazy.
And there's processed food for that demographic as well. And I guess the third one, coupled with the food, is just try not to be a dietary food consumer. That's another really big thing I like to express to my clients. And what I mean by that is if the food item that you're purchasing has some form of no fat, low carb,
Yeah,
dietary based food, it's probably not good for you because it's just not, it's full of processed items. And I really like to just recommend to people try to eat a higher fiber diet because there's no
yeah.
bad foods that are high in fiber
Yeah,
for you.
absolutely. And it'll help with your insulin, and it'll help you burn fat, and it'll help your bowels move better. I mean, it's a win-win. So that's awesome, man. We could probably talk all day about this. And that's what I said. You're like, what are we gonna talk about? We got nothing wrong to talk about.
I was like,
Oh,
"Hey, Troy, can we just do this for 10 minutes?" He's like, "No, we're gonna do it for a half hour."
yeah, whatever, however long we go. We could go another half hour if you wanted, but I know you're busy working people out and training them, and I appreciate you as a friend and a colleague, and a little golf buddy on the side.
Yeah,
So,
that's fun.
yeah. So anyway, I appreciate your time, and on the show notes, we'll put your website, contact information, stuff, so
Cool.
people want to reach out to you, they can, and people know where
Awesome.
to find me. So, anyway, Adrian, thanks again, buddy. Appreciate you being on the show today. Everything This with Dr. Troy.
Thanks, sir. Appreciate your time.
Thank you.